Hydrocephalus is a complex neurological condition characterized by the abnormal accumulation of cerebrospinal fluid, CSF, within the ventricles of the brain. It can occur at any age and has diverse etiologies, including congenital malformations, acquired pathologies, and idiopathic causes. This script aims to provide a comprehensive overview of hydrocephalus, including its classification, pathophysiology, clinical presentation, diagnostic evaluation, treatment options, complications, and prognosis. Additionally, it will explore specific subtypes such as congenital hydrocephalus, adult-onset hydrocephalus, normal pressure hydrocephalus, and the relationship between hydrocephalus and neurodevelopmental disorders. Finally, the script will highlight current research advancements in the field. This knowledge is crucial for medical students to understand the clinical management of hydrocephalus and to provide optimal care to affected individuals. Hydrocephalus is a condition where there is an accumulation of CSF within the ventricular system of the brain, leading to increased intracranial pressure, ICP. This abnormal accumulation can result from an imbalance between the production and absorption of CSF or obstruction of its normal flow within the ventricular system. Hydrocephalus can affect individuals of all ages, from infants to the elderly, and can manifest with a wide range of symptoms depending on the underlying cause and severity of the condition. Hydrocephalus can be classified into various types based on different criteria. The most commonly used classification system categorizes hydrocephalus into communicating and non-communicating types. In communicating hydrocephalus, there is an impairment in the absorption of CSF, leading to its accumulation, often due to malabsorption or obstruction of the arachnoid granulations. Non-communicating hydrocephalus, on the other hand, results from obstruction within the ventricular system, preventing the normal flow of CSF. This obstruction can occur at various levels, including the aqueduct of Sylvius, the foramina of Monro or Luschka, or within the ventricles themselves. Other classification systems include congenital versus acquired hydrocephalus, as well as high pressure versus normal pressure hydrocephalus. The pathophysiology of hydrocephalus involves the disruption of normal CSF dynamics within the ventricular system and its subsequent effects on brain tissue. The primary underlying mechanisms include impaired CSF production, obstruction of CSF flow, or impaired CSF absorption. These pathophysiological alterations ultimately lead to an increase in intracranial pressure, which can cause compression and damage to surrounding brain structures. The specific pathophysiology may differ depending on the subtype of hydrocephalus, highlighting the importance of accurate diagnosis and individualized management. The clinical presentation of hydrocephalus varies widely and depends on several factors, including the age of onset, rate of progression, and severity of the condition. In infants, hydrocephalus may present with symptoms such as an enlarged head circumference, rapid head growth, bulging fontanelle, irritability, vomiting, and poor feeding. Older children and adults may experience symptoms such as headaches, nausea, vomiting, visual disturbances, gait disturbances, cognitive impairments, and urinary incontinence. The specific symptoms and their severity can help differentiate hydrocephalus from other neurological conditions and guide diagnostic evaluation. The diagnostic evaluation of hydrocephalus involves a comprehensive assessment to determine the underlying cause, severity, and impact on brain function. The evaluation typically begins with a thorough clinical history and physical examination to identify characteristic signs and symptoms. Diagnostic imaging, including magnetic resonance imaging, MRI, is crucial in visualizing the ventricular system, identifying potential obstruction sites, and assessing the overall brain anatomy. Additional tests, such as lumbar puncture or intracranial pressure monitoring, may be performed to confirm the diagnosis and assess CSF dynamics. The treatment of hydrocephalus aims to alleviate symptoms, reduce intracranial pressure, restore normal CSF dynamics, and prevent further damage to the brain. The primary treatment approach involves surgical intervention, which may include the placement of a shunt system to divert CSF from the ventricles to another body cavity, such as the peritoneal cavity or right atrium. Alternative surgical options, such as endoscopic third ventriculostomy, may be considered in selected cases. Medical management with medication, such as acetazolamide, can help reduce CSF production and control symptoms in some cases. Hydrocephalus can be associated with various complications, including infection, shunt malfunction, overdrainage, and increased susceptibility to injury. Prompt recognition and management of these complications are essential to maximize patient outcomes. The prognosis of hydrocephalus is variable and largely depends on the underlying cause, timeliness of intervention, and the presence of any associated brain damage. Early diagnosis and appropriate treatment significantly improve the overall prognosis and quality of life for affected individuals. Congenital hydrocephalus refers to hydrocephalus that is present at birth or develops shortly thereafter. It can result from a wide range of causes, including prenatal infections, genetic abnormalities, intrauterine hemorrhage, or structural malformations of the central nervous system. The management of congenital hydrocephalus often involves a multidisciplinary approach, including neurosurgical intervention, medical monitoring, and early intervention services to address potential developmental delays. Hydrocephalus can also develop in adults, either as a result of congenital malformations that were initially asymptomatic or due to acquired causes such as traumatic brain injury, intraventricular hemorrhage, or brain tumors. The clinical presentation of adult-onset hydrocephalus may differ from that in pediatric cases due to the presence of comorbidities and age-related changes. The diagnosis and management of adult-onset hydrocephalus require a comprehensive evaluation and collaboration between neurologists, neurosurgeons, and other specialists. Normal pressure hydrocephalus, NPH, is a unique subtype of hydrocephalus characterized by enlarged ventricles, normal or slightly elevated CSF pressure, and the triad of symptoms consisting of gait disturbances, cognitive impairments, and urinary incontinence. The pathophysiology of NPH is not completely understood, but it is believed to involve impaired CSF reabsorption or altered compliance of brain tissue. Timely diagnosis and surgical intervention with a shunt system can lead to significant improvement in symptoms and functional outcomes in selected NPH cases. There is a known association between hydrocephalus and neurodevelopmental disorders, including intellectual disabilities, learning difficulties, and motor impairments. The complex relationship between hydrocephalus and neurodevelopmental outcomes warrants close monitoring, early intervention, and tailored educational support for affected individuals. Ongoing research is shedding light on the mechanisms underlying these associations and offering potential therapeutic targets to mitigate the burden of neurodevelopmental disabilities in hydrocephalus patients. Continued research efforts are focused on advancing our understanding of the pathogenesis, diagnosis, and treatment options for hydrocephalus. These include innovations in neuroimaging techniques, genetic testing, and surgical interventions. Additionally, ongoing studies aim to elucidate the long-term outcomes and quality of life in individuals with hydrocephalus. Research collaborations and clinical trials are essential in driving progress and improving the management and outcomes for patients affected by this complex condition. In conclusion, hydrocephalus is a neurologic condition characterized by the abnormal accumulation of CSF within the ventricular system of the brain. It can have diverse etiologies and can manifest with various symptoms and complications. The accurate diagnosis, appropriate treatment, and long-term management of hydrocephalus require a multidisciplinary approach and a thorough understanding of its pathophysiology. Clinicians must remain up to date with the latest research advances to optimize patient outcomes and improve the quality of life for individuals living with hydrocephalus.